Hi, my name is Andrea Kincade.
And I'm Sara Orr.
And I'm Doreen Cannon.
We introduce to you a Zika prevention kit specifically made for people in Brazil through our organization titled BUZZ, which stands for Brazil United for Zero Zika. Zika virus is at an epidemic level in Brazil. There is no cure for Zika nor specific medications to impair the virus. Symptomatic treatment is the only option. Therefore, it is important to stress prevention as the key to avoiding this virus. With this in mind, our kit will assist in prevention education, sanitation, and mosquito control using all barriers possible.
A barrier we came across was how to contain our live fish in the kit without killing them. The solution we found most feasible is a vented Rubbermaid container where the fish rests at the bottom in water with a vent for air circulation. We utilize plastic bags to hold all other kit supplies and to keep them dry. It is important to use the local mosquito-eating fish for the ease of transportation, reduction of costs, and less environmental impact. We selected the sambo fish, a native fish in Brazil, for our kit. Dunks. Dunks are considered one of the most effective products on the market at reducing the mosquito population. The dunks are made of naturally occurring bacteria in soil. Bed nets. Bed nets are very effective with proper use. They must completely surround and be tucked under the bed. Any holes in the net are obviously a port of entry for the mosquito. A house screen is important for the prevention of mosquitoes flying around the home. Screws are included as many houses in Brazil are made of various materials, including brick. DEET. DEET works very well when used correctly as a mosquito repellent. Recent reviews of DEET's effective on human health finds that the insect repellent is safe to use on the skin. Education. Education pamphlets will help assist in explaining the Zika virus and how to avoid it. These pamphlets will be written in Portuguese as well as English, as for those who need assistance in training. Pictured instructions will assist those who may not have an excellent or any reading skills to understand how the products in our kits are used.
Funding. Grants are available to help fund programs that assist in fighting the Zika virus. We'll use grants from the CDC, and the funds will assist us until local governments adopt and fund the program themselves. We will seek grants from the CDC, WHO, the Pan American Health Organization, and the Bill and Melinda Gates Foundation, which will enable us to perform the groundwork necessary to address the Zika crisis in Brazil. There are many companies who may be available to assist with monetary or supply donations. They may even be able and willing to supply volunteer hours. As stewards over this program, we feel it is crucial to be careful with the funds we receive. As good stewards, it will be important to look to other companies for donations from, such as airlines and hotel companies, to obtain donated or reduced flights for all program participants who need to travel to and within Brazil. Companies who do business with Brazil will be motivated to help to garner positive publicity and goodwill for themselves. Also, their employees in Brazil will face the possibility of being affected by the Zika virus, so they will be assisting in the protection of their employees. Pregnant women require special attention to prevent Zika-related complications in their unborn child. Because Zika can be transmitted through sexual contact, women's partners also need to be involved in educational sessions. In Brazil, many maternity hospitals run prenatal care courses during pregnancy. Zika prevention can be included in these courses. Before presenting materials in the community, we will advertise our program through public service announcements on the radio and television. Advertising is essential to increase an awareness of the prevention and spread of the Zika virus. We will use local community buildings to help promote the Zika prevention kits, as well as the time and place of the distribution of the kits. This promotion will help increase attendance.
Because we are enlisting the help of senior LDS missionaries to present our materials, we will use LDS meeting houses, as well as community centers, health clinics, and school buildings to meet with the community for our presentations. Some of the organizations we will partner with are Operation Blessing, the Pan American Health Organization, Centers for Disease Control, the World Health Organization, Brazil's Ministry of Health, and the Church of Jesus Christ of Latter-day Saints. We will partner up with various organizations in order to take advantage of their resources and expertise. Operation Blessing already has experience in the transport and distribution of mosquito fish. The Church of Jesus Christ of Latter-day Saints and Brazil's Ministry of Health will provide personnel who will present and distribute our materials to the communities. The Pan American Health Organization, CDC, and WHO will provide educational materials and funding for the program. To begin with, our training will be conducted by program employees within Brazil, but we will be training local health workers, LDS missionaries, and church members to take over within the affected communities. We will be training on how to transport and distribute mosquito fish, how to assemble the kits, what to do with the materials in the kits, and the presentation of Zika prevention materials. This training will take place wherever it is convenient, whether that is LDS meeting houses, community centers, health clinics, or school buildings. Human resource organizations will include the Pan American Health Organization, the Brazil Ministry of Health, and the aid of the Church of Jesus Christ of Latter-day Saints. Through the collaboration of these different entities, we can fulfill all human resource needs. Our solution to the language barrier is to work with LDS missionaries and volunteer teams to help in assembly and delivery efforts, as well as translation. To keep the program going, we will give sample kits to government offices with materials and letters explaining the process we used and the complication resolutions we came up with for their reference. It would be exciting to use this kit in a pilot program for overall care to populations burdened with mosquitoes carried diseases as well. Thank you for watching.